mental health condition is a great challenge that we are facing as a country in Ghana. Many people are going through various forms of mental illness, but we've just decided not to pay too much attention to it. But we think that it is a very serious national threat that if you don't give the necessary attention to it, it is going to cause us problems in the near future. It is very, very important to quiz a great mind, but it is also very, very, very needed for us to pay attention to those who are having mental ailment or weaknesses within our society. That's why today we are here as Astamin TV to talk to a mental health expert about the challenges that they face in their work and what we could do as a nation in resolving these problems that is gradually creeping into our society. Good afternoon, Mama.
Hello, good afternoon.
Welcome to Astamin TV.
Thank you.
And we thank you for hosting us in your house.
You're always welcome.
Please, may we know your name and what you do, and we'll continue from there.
Okay, so my name is Vida Nakie, and I'm a mental health practitioner in the UK. I've been practicing for over 20 years in the UK, and I was trained in the UK. So I did my nursing profession in UK. That was years back. Yes.
All right, that's very beautiful, and we are lucky that Ghanaians are doing marvelous things in the diaspora. But we pray that one day you will see the need to come back to the motherland to also give us such services.
Very soon, very soon.
So, Mom, when I was reading about your profile and I saw that you were a mental health practitioner, I mean, it really struck me deep because, you know, in our society, you drive around, you walk through your neighborhood, and you see a lot of mentally deranged people walking about. And there are a lot more also in suits that are not really all right out there.
Yeah.
So, in your first submission, what should you think we should do about mental health as Ghanaians? How do we approach it?
I think what I've realized is when we say our African culture, one, I think because of the stigma, people don't really come out when their families are having mental health challenges. And we are so naive, lack of knowledge when it comes to mental health. I feel in Africa, not Ghana alone, but in Africa, mental health is being ignored completely. People are not really, coming up when they have mental issues. They feel, oh, this is just something that is just by the way, the person will be okay. Or when it's very severe, what they come up with, this person is, is bewitched, or he is a wizard, she's a witch, or he's gone for somebody's husband and they've done that to her. They've got, they come up with different assumptions, whereas they should rather seek for medical attention. So mental health in Africa is so sad that it's not really being recognized that it's a big issue that we Africans should tackle. You see, like you're saying, you see a lot of people who have mental health issues. The ones that can be managed at home, families try to cover that up and manage them at home. Those that cannot be managed and they've gone missing, so sad, you see them on the street. Some of them are naked, some of them, which really shouldn't be. I feel that mental health is being neglected completely when it comes to our African society. So I feel that, truly the government should create some awareness that mental health is real and it can happen to anyone. There's no exception. It can happen to anyone. It can happen to you. It can happen to me, your mom, anyone. So mental health is real, and I feel that if you seek for medical attention in time, things will get more better than it's getting worse, and then you see your family member outside naked, and so I feel that we still have a long way to go when it comes to mental health.
Okay, we have a long way to go when it comes to
yes
mental health. We are still live on Astamen TV, and we are talking to our mother, Mama Vivian, about mental health issues in our country and Africa as a whole. So please, Mom, as you are saying, a lot of factors bring about mental health issues.
Yes.
But what we are used to is that the moment you see someone showing signs of abnormality, society just conclude that maybe the person is using hard drugs or things like that. So please, I want you to educate us on the factors that can affect a person's mental health.
Okay, so when we talk about mental health, what is mental health? Mental health is when, you're not able to think normal, like a normal person, doing things out of the norm. Yeah, when we talk of mental health, we have different types of mental health. Like the one you're saying, that when someone is behaving strangely, they conclude that the person maybe has gone for hard drugs and all that. Yes, there is a link to that, which they call drug-induced psychosis. Drug-induced psychosis, that is someone who is on drugs, different drugs, and that brings on the psychosis. So it is the drugs that has induced that mental health. And apart from that, we've got something called genetics. Genetics, there might be someone in the family who has mental health issues. And when it's in the family, it's very easy for this to transfer to somebody else in the family. Maybe your auntie, your mom, from mom's side, from dad's side, anyone can get it. And when we talk of mental health, there are different types of mental health issues. We have bipolar affective disorder. We have paranoid schizophrenia. We have like I said, the drug-induced psychosis. We have emotional unstable personality disorder. So it comes in different forms. And some of this mental health, mainly when you look at it, some are being brought on by lifestyle. When I say lifestyle, which is the, let's say the drug-induced one, taking different types of drugs. Some could be life events, life stresses. We have, that one is depression. Someone who will be suffering from depression might have gone through some life events that has been very stressful. Let's say someone who is bereaved, someone who has lost a member of a family member, a husband, a brother, who he or she is very close to. This person can suffer from depression. Financial loss, someone can suffer from depression from that. When I say life stresses, things that are going on in your life that has been very stressful, even relationship breakdown. Relationship breakdown can give you trauma, and out of the trauma you can be depressed. And what I've realized is most of these things are not being tackled well here. I've got friends who have called me after I made a program on GTV. That was somewhere, was it last week? And after that I had few calls of people, the main topic I did was dementia, which this dementia affects older people, our grandmoms, granddads, even our moms, from 60 upwards, some of them unfortunately do get this dementia. So I had a call from a lady, and she said she doesn't know whether the sister is suffering from dementia or depression. She doesn't know. So I spoke to her and I asked her everything that was going on, and at the end you can see that it's mainly to do with trauma. that she's been through from young age. Relationship breakdown, after relationship breakdown, she had issues at work, and all these things were not solved. So it was there, and it kept building up, and unfortunately it has turned into psychosis. So these are some of the things. Whereas when they saw it at the beginning, if they had done something about it, maybe she could have gone for talking therapy, where they would talk her through whatever she went through, the relationship breakdown, and then maybe give her some little dose of antidepressant that will lift her mood up. Because normally what they say is, when you are depressed, is the serotonin in our brain, that is what is really gone down, and that is why your mood is down. That is what controls our mood. That is what makes you feel happy, makes you feel low. So in case of any events that you are not able to cope, what happens is it brings down the serotonin, and then your mood and everything is low. So what they do is, this antidepressant that they give, what it does is it lifts up your mood a bit and brings it back to the normal. And then with therapy, you get over it so quickly. But this wasn't treated, it was there, and then she had different series of life events that really affected her. So it's so sad that it's turned into something else, where when she's there, she believes that people are shooting her, but she's still alive. So I even asked her, is it spiritually? Is it physically? She said, no, it's not spiritually, it's physically. I can see them shooting me. Wow. And there's nothing that I was trying to explain that she got what I was saying. So I just had to, it gets to a point where you have to just go with them, just for them to feel that you're listening to them, you're believing them. But that shows you that, no, this person is gone to a different stage where she's suffering from psychosis. Because for someone to be shooting you in the belly and you're still alive, shooting you in the head and you're still alive, and that is her belief that, yes, this is being done to me every day. Okay,
so it means the brain itself, depending on its mood, can be creating images. Oh yes,
it can. It can be creating images for you, yes. Especially when already the mood is very low and you're thinking of a lot of things. Or if I were to be in my marriage, I would have had maybe 1 or 2 kids. Since that happened, she's never got into any relationship again. And she's nearly old now. She's never had any relationship again. So that is playing up on her mind. A job that she was meant to have, someone went backstage and took the job from her. So all these things have been building up.
So it's like a pile of events.
Yes, that hasn't been dealt with.
Okay, Mom, I think what you said so far has been very, very plain and then very understandable. But I want us to really focus on dementia. Dementia is one health state or one mental health challenge that we don't know much about it in our part of the world. And even though the few who also know about it don't pay much attention to it. And it is gradually creeping into our society. So I want you to say something small about dementia. When we say dementia, how does I or the other normal person on the street have to perceive dementia to be?
Okay. So when we talk about dementia, there's Alzheimer's. Alzheimer's is what leads to dementia. It's a different part of I would say mental illness, which affects mainly the older people. And surprisingly, this time, even the young ones are getting it. The young ones from 40 are getting it, and mainly those who are dependent on alcohol. With this dementia, we've got different types of dementia. When we say dementia is when the brain is not really functioning properly. Dementia is when the neurons are not connecting well to the cells in the brain. So part of the brain cells die. Part of them doesn't get oxygen. Part of them do get a plague on it. So when it happens that way, your normal way of functioning is affected. So you are not able to think properly. You are not able to do things the right way. It affects your behavior. Your behavior changes. You become very irritable easily. You start forgetting things very easily. You place something here, and then after a few minutes, you come back, and you'll be saying someone is taking it, whereas you've placed it somewhere else. You know, so that is how the dementia starts. It starts with forgetfulness, going out and not able to find your way back home. Yes, dementia is actually, what would I say, very, very serious. But it's so sad that in our African culture, we don't take it seriously. And with the older people, that is when they come up to say, oh, this person is a witch, this person is a wizard. Maybe the person had gone out naked. It's dementia. But the fact that they've seen the person going out naked, the person is a witch. The person is a wizard. And when you are not careful, that is when, unfortunately, people start to stone them, kill them, burn them. It's so sad. It's so sad. So dementia, it comes in different forms. We've got different types of dementia. And each dementia with its presentation. We've got the Lewy body dementia, which affects your behavior. We've got vascular dementia. This vascular dementia, it affects your behavior as well. We've got frontal lobe. Frontal lobe normally comes at the front, yes, of your head, frontal lobe. We've got different types of dementia. We've got the Korsakoff dementia. That one, you do get it through alcohol. Yes, when the alcohol saturates so much in the brain.
What about
Parkinson's leads to dementia as well.
But why is it that I've found out that Parkinson's disease particularly is mostly linked with sports, people who were into sports, like boxers, footballers. What is it about Parkinson's disease and then sports?
It's mainly to do with the brain. You know, some of them, they do get all these brain injuries and all that, all these boxers and things. Although they put on things to protect themselves, still, you know, they do get blows that goes to their head. They do get, so all these things, they affect your brain, they affect your nerves and all those things. And apart from that, some of these illnesses are genetics as well.
So it means you can get mental ailment through
through Parkinson's, yeah.
Through I want to put it this way, through the work that you do. Yeah,
through the work that you do, you can get it as well. Through the work that you do, yes.
So, Mom, this thing, even myself, until I had the chance to interview you, that I had to do some digging about it. I got to find out that there are lots that I don't even know. So what I'm trying to say is that, let's say we are in the home setting. How does the individual who is going through the early stage of mental ailment, what are the signs that will make that person know that, okay, I think this is happening to me and I need to seek medical help. And then secondly, the other people living with him or her, what are the signs that they should also look out for, so that they know that, okay, maybe mommy is going through this, daddy is going through that, auntie is going through this. And then how do we also approach it, that problem, when we are certain that, okay, this is it, how do we approach it in a way of helping them?
Okay, so you're living with your mom, your dad, you know their behavior, you know the way they behave at home and everything. The moment you see any changes in their behavior, changes, let's say one, forgetfulness. Okay, forgetfulness is not that very serious, because as we age, you know, forgetfulness sets in. But it's not that severe that you even forget your own daughter, your own son when you see them. You know, so when the behavior starts changing, they start accusing people. Oh, you've taken this of mine, you've taken that of mine. They become very, very paranoid. They start accusing people. They become irritable. Any little thing, they get upset. Anything that they are not meant to be upset, they will be upset. Very paranoid, they will see you talking to someone else, they will come to you, oh, why are you talking about me? So all these things, you'll be surprised that, oh, mom wasn't like this before. How come mom have started behaving this way? Sometimes they will even forget where the toilet is. That one, that has got to the last stages where they forget how to even eat, how to use the toilet, going out and not be able to find their way home. So at home, when you see those behavior changes, that they are becoming very irritable for no reason, their sleep is disturbed, they are not able to sleep well like the way they do, you know, their sleeping pattern changes. Their day becomes night and their night becomes day. So during the day, they are sleeping all day. During the night, they are wide awake, moving from one room to the other, picking things. That means it's gone to the last stages. You know, so these are some of the things, behavior changes.
Behavioral changes.
Yes.
Ma'am, as a family member or as a person living in such a person, when you come to notice these signs, being displayed by the victim, how then do you approach the person? Asking, how do you then form the bridge between the victim and then the health practitioner, or how do you convince the person to go with you to the health facility for a medical attention? Because I know when it gets to that stage,
they are in denial.
It's very difficult.
Yes, they are in denial. They never accept it that they are. Sometimes it's the fear. It's the fear. When it starts, it's not like they are not aware of what is going on. At the beginning, it brings them that fear that, oh, I'm becoming forgetful. You know, the brain switches in and out. So 1 minute they'll be fine, they'll be doing things, you know, all right, and then the next minute it switches again. So they have that fear that, oh no, it seems I'm coming up with something. It's not like they are not aware, they are aware, but it gets to a point where they are in denial that no, this can't be happening to me. Oh, it's just a normal thing. So with you as a family member, you have to be extra patient. Because with their behavior and everything, if you don't have that patience, you'll be very angry, you'll be arguing and shouting at them, whereas it's not registering for them at all. Because of where the brain system is at that time, it's not registering. So you have to be extra patient. Don't tell them that, I think you're coming up with mental illness, let's go and see the doctor. You can find another way to convince them, oh, I can see that these days you don't feel well. Why don't we go and see the doctor to do some tests to see what is happening, whether you've got malaria or what. With that, people do accept physical health easily more than mental health. So if you should tell, oh, I've seen that you are behaving very bizarre, you're forgetting things, you're putting things here, you are arguing, they'll tell you, no, I don't have any mental illness. It seems you are the one that have it. So you have to find a way to convince them. Physical health is very easily acceptable for them. Oh, I can see maybe, I don't know, maybe you're coming up with some malaria, so why don't we go to the hospital for a doctor to see you? And that is how you'll be able to get them from the house to wherever you're taking them to. Like I always say, I don't know how the system here is, but over there in the UK, they have a series of tests that they can do to detect dementia. They have CT head scan or MRI. I know they have CT and
MRI.
Yes.
But it's very expensive.
It's very expensive, but then if you love your loved one and you don't want them to go insane to the point where they will be going out naked, you know, going out and not being able to find their way home, people stoning them, you know. I quite remember one of my interview, the presenter was saying that his dad got missing, but thank God they found him. They didn't know what was going on. It was later that they found out that, you know, he had dementia. So I know it's expensive, but you know, you have to try as much as you can. And with the scan, they do MRI scan of the head or CT scan of the head, and depending on the deficits that they find in the brain, that is what will tell you what sort of dementia this person is coming up with. So it shows the deficits and on what side of the brain, because the side of the brain that is affected is what shows the behavior. You know, so let's say the part that tells them that I want to use the toilet, I want to eat, if that part is affected, they forget how to eat, they forget how to use the toilet.
Okay. All right, Mom. So you've made mention of lifestyle, as in the things that you consume and stuff like that. And then also you can also suffer from it through genetics.
Yes.
But what about the use of these gadgets, phones, staying long hours on your phone, spending long hours on your laptop, with the light of the screen beaming into your eyes? Can it also affect your mental health?
With that, I haven't really come up with a research to say that it affects your mental health. But what I know is it can contribute to depression. Yeah, it can contribute to depression. And with depression, fine, depression too is mental health, but depression is something that is it can easily be resolved by therapy and medication. But unfortunately, when it comes to dementia is not curable. Unfortunately, when you get dementia, it's for life. The only thing they can do for dementia is to delay the progress by medication. Some come in patches, some come in tablets, and when they are on that stage, most of them, they refuse to take medication. No matter what you do, they will never take medication. So they came up with a patch where you can put it at the back of their, you know, where their hand cannot reach to take it off. So the patch, when you put the patch, it releases the medication into the system slowly.
It simmers through the skin.
Yes, it goes through the skin, and that is what delays the progression. So it's going to delay it, because one thing with dementia, unfortunately, dementia progresses very fast, very, very fast, that the person will deteriorate to the extent that, you know, you have to feed them, you have to wash them, you have to do everything for them. You know, so it progresses so easily. So what the medication does, it delays the progression of it. They can still live a normal life, although there will be little bits and pieces of forgetfulness and some odd behaviors, which can be manageable, yes, with the medication.
This has also preempted me. Most often than not, these signs that you are making mention of forgetfulness, ill behavior and other things that you spoke about, these are the same things too that when you go to these women fellowship, men fellowship, they tell you that these are the same signs that they tell you that it's when a person is moving into the menopausal age. So if I am seeing these signs and they tell me it's because your mother is beginning to talk too much, is beginning to easily get angry because she is going through the menopausal stage, how then do I differentiate between if this is as a result of menopause or this is as a result of a mental health situation? So I need to maybe act fast, because like in Ghana, everything that when our parents get to that stage, because it's been placed in our mind that it is as a result of andropause and menopause, when your mom or your dad begins to behave in a certain way, you just laugh and you say, oh, menopause.
I think I've heard it before. Yeah, I've heard it, and I think it's would I say a phrase that most of the Ghanaians use. You know, even sometimes my own kids.
They'll tell you that, oh, don't mind me, you know, it's my menopause.
Menopause has nothing to do with mental health. Unfortunately, menopause is something different. Although sometimes when people start their menopause, they react so badly that sometimes they become confused. Because of the menopause stage, a lot of the hormones are changing. When you get to this menopause, the hormones are changing. So there will be a lot of different things going on with you. However, it's not mental illness. And it's not everyone that reacts to menopause. Everybody is different. With menopause, some people do get all these hot flashes. 1 minute they are hot, the next minute they are cold, mood changes, they become irritable. You know, some of the symptoms is more or less like I would say mental illness, but it's not. It's because of the hormones that are changing. And when it comes to that, because we are losing a lot of things,